if you're sitting here thinking, well, my child never had a tick bite, so none of this applies to me, I'm sorry, but you're wrong. These conventional tests that are available through, the local labs and even hospitals, they are not looking for all of the species of Borrelia. Instead of looking at all 20 species, we've looked at one or two.
This is Doctor Talks.
Welcome to another really great interview for the MS and Autoimmune Summit. And this is going to be a really compelling topic for many of you. Dr. Myriah Hinchey is a naturopathic physician and a fellow at the Medical Academy of Pediatric Special Needs, and she's a recognized expert in the area of Lyme. Now, the reason I'm so excited to have her is that Lyme often co-occurs with people who have an autoimmune disease, including multiple sclerosis. So it's really an important area to consider. And so with that, I'm going to hand this over to Dr. Hinchey and see if there's anything else you'd like to add to your introduction.
Thank you. No, I'm so excited to be here and helping to get out true information regarding Lyme disease and other vector-borne diseases is really my mission. And, this stems from being a naturopathic doctor who's trained to find the root or underlying cause. Oftentimes, not that Lyme is not all over the world, but where I live here in Connecticut, which was pretty much ground zero, oftentimes, when you're looking for that root cause, with a lot of my patients, it turned out to be Lyme disease or a co-infection. Um, so I've treated multiple patients, multiple family members, unfortunately myself. And actually, I shouldn't say unfortunately, because I will tell you, sitting here with what I do 17 years later really has come from not only what I've learned from my amazing mentors, but I think like you, Terry, going through this yourself and having to learn on yourself and having not just having where someone describes a symptom and you're like, I know exactly what you're talking about when nobody else has, but also really being able to walk the talk, right? So, like
Mhm.
all of the lifestyle stuff that I do, all of the fixing the immune system and healing the gut and everything that I talk about, I really had to go through and experience myself. And then, I kind of say like everything happens for a reason. And that happened to me so that now I'm able to help all of my patients.
Which is why I'm so excited to have you as part of our summit. So let's sort of step back a little bit and we talk about vector-borne illnesses. I know ticks have been around for a long time. They're part of the ecosystem. I grew up as a kid on a farm. We had plenty of ticks, a wide variety of ticks that we were taking off our dogs, off ourselves. I did a lot of camping, so again, plenty of ticks. And many of us are exposed to a wide variety of ticks. What you mentioned vector-borne illnesses. What all do we have to think about for those of us who are exposed to ticks?
So I would, and I'll just make a clarification. So I say vector porn because, for example, there's Bartonella, which is a co-infection, of Lyme disease, and it's not just transmitted by ticks. So it's also mainly transmitted by fleas. So just want to point out because so many people will say, well, my child never had a tick bite, or I never had a tick bite, or I never had the EM rash, which, by the way, less than 40% of people even have an EM rash
Oh,
when
well,
they
hang
get
on.
Lyme.
People may not know what EM is, so
Oh,
let's
sorry.
yes, let's take that.
Erythema migraine. So it's that classic bullseye rash, where you have the red ring and then the central clearing. And a lot of times it will spread as it goes. So a lot of people rely on that rash for diagnostic criteria. And it actually happens in less than 40% of people diagnosed with Lyme disease. But again, I say vector because there are other routes of transmission for Lyme and co-infections than just a tick bite.
Okay, very important for all of us to know. So fleas and ticks. So you mentioned Bartonella. What is Bartonella?
So Bartonella is a bacteria. I would say, to get into the symptomology, it's most famous for causing, I would say, kind of like sinusy like headaches, brain fog. There's a lot of neuropsychiatric symptoms that accompany it, like anxiety, panic attacks, depression. There's can be a lot of irritability and rage. Some of the physical symptoms are, like I said, brain fog, headache, pain in the soles of your feet seem to be a
Mhm.
classic Bartonella symptom. We can have lymphadenopathy or swollen glands, and there tends to be a classic striae rash that kind of looks like stretch marks, but it can migrate around the body. And unlike stretch marks, when you press on it, it will blanch or turn white, whereas typical stretch marks would not. And then obviously, stretch marks, which are basically scars, would not come and go, and they certainly wouldn't move around the body. And the patients who end up with this striae get them in very strange areas. So, there's pretty classic areas where one
Mhm.
would get a stretch mark. And so this striae does not follow the normal dermal planes that a typical stretch mark would follow. So Bartonella causes a lot of neuropsychiatric symptoms and a lot of central nervous symptoms
Okay.
as well.
And then we should also talk about Lyme. So we had a
Sure.
little clue on Bartonella. The
Yeah.
other big thing, Lyme.
So I would say acutely, Lyme presents like a flu. So you can just have general feelings of malaise or not feeling well, a lot of fatigue. You can have a stiff neck, can often be one of the first signs of neurological Lyme, but it's very hard to tell between the acute presentation of Lyme disease and something like, like your typical flu. So summer flus aren't common. And, if you find yourself having symptoms of a flu and you've been to the clinic and they say, well, this isn't influenza A or B and we can't really figure out what it is, then you should definitely try to assess for whether or not it could be Lyme. And I don't want to mislead people by saying a summer flu because these ticks are out year round. I have pictures of these ticks literally crawling in the snow. And, the highest months of transmission are actually April and October. So we think of this as a summer thing, and we think of this as something that you have to go into the woods for or go camping or, hiking or something like that. But I mean, it's in mowed grass. We
Mhm.
spray, we are very diligent. My son had a larva tick in the back of his head 2 weeks ago. Thank God it came back negative. But I mean, you could barely see the thing, and he had just been outside playing in a yard that is sprayed routinely.
Okay, so I think we have a sense of acute symptoms. Many of the folks listening, have multiple sclerosis, newly diagnosed, or being worked up for it, or have had MS for a few years. Should they be thinking about Lyme as well?
Well, I think so for sure. So, as I'm sure Lyme is the great imitator. It mimics every other disease and disorder out there. And it's because Lyme infects every single cell in the body. So, it has the potential to cause symptoms, especially chronically, in every part of the body. When I look at Lyme disease chronically, I look at basically the inflammatory piece of it, right? As well as the immune dysfunction. And not only does the immune dysfunction and the inflammation cause a host of the symptoms, as well as the cellular degeneration in the body, but it's also what allows this organism to evade the immune system and get its chronicity in our bodies, if that makes sense.
Sure.
So,
Uh, so we could have our diagnosis of MS. I'm getting my treatment, maybe Ocrevus, very common treatment right now. I seem to be doing okay. Do I still need to be thinking that we should investigate the possibility of Lyme?
So I would think so. And you tell me after if you agree. So I feel like most of our conditions, chronic diseases in this country, I mean, everything, even, right down to cardiovascular disease, right? At the root of it is inflammation and immune dysfunction. And so with MS, with it being, like a neuroimmune disease in my mind, anything that is going to make our immune system less competent and anything that's going to drive more inflammation, I would think would enhance the acceleration, right,
Mhm.
that a patient with MS would deteriorate. And so, if Lyme or a co infection or even viruses or anything that's going to drive that inflammation and cause immune dysfunction is at the root, right, one of the underlying causes of why MS developed, it would be important to address those things, get inflammation as low as possible, get our immune system functioning as correctly as possible. And I would think that that would either halt the deterioration or it could even help to reverse some of the symptoms that patients are experiencing.
Okay, so I think you've made a good case that we should be thinking about, could Lyme be part of my illness? And so if our listeners are like, okay, I should talk to my medical team about this, what would you be asking your medical team to check?
Okay, so we'll talk a little bit about diagnosis and testing, which certainly is probably one of the most controversial pieces of this disease. So, a few things. Number one, Lyme is a clinical diagnosis. So, we cannot just rely on a test saying positive or negative to get that diagnosis. And even if you go to the CDC's website, it says that Lyme should be diagnosed based off of clinical findings, the possibility of you being infected, right? And then certain laboratory findings should be used to basically back up the diagnosis. Okay. But a lot of clinicians are just ordering a test. And if the test comes back positive, you're positive. If it comes back negative, even though you might have every symptom in the book of Lyme disease, they will say that you're negative. And so, one of the biggest issues is that with these commercial laboratories like Quest or LabCorp or any hospital lab, they are, if you go in and you just have a test for Borrelia burgdorferi, that is all they are looking for. So right now, there are, depending on which laboratory you use, between 17 and 20 different species of Borrelia that are known to cause either Lyme disease or tick-borne relapsing fever, TBRF, which is another basically type of Lyme disease, still caused by Borrelia. And the conventional testing is only looking at Borrelia burgdorferi. So there's Borrelia miyamotoi, there's Borrelia afzeli, there's Borrelia californiensis. There's all of these different species of Borrelia that cause Lyme. And so the typical scenario is the patient gets tested and they get tested for one of them. And then that is so specific to that species. And then they're told, nope, you don't have Lyme. So the analogy that I use with my patients is that, that's like me saying, I'm going to test you for an apple, but I'm going to use a test that will only detect a Granny Smith apple. So if you have a Golden Delicious or a Red Delicious or a Macintosh or a Honey Crisp or a Gala, you could be holding it right there. And I'm going to say, no, you don't have a Granny Smith. Therefore, you don't have an apple. And you're going to tell me I'm crazy. And I'm going to agree because that's how bad the testing is when it comes to looking at Lyme disease. And then, just like a test for an apple isn't going to tell you if you have an orange or a pear or a banana, testing you for Lyme disease is not going to tell you if you have Babesia or Bartonella or Ehrlichia or Anaplasma, right? These are all completely different types of bacteria, and Babesia is a parasite.
Okay, so there are many considerations that you've just listed that should be considered. And your most primary care folks, most neurologists, are not as knowledgeable about all of these tick-borne, vector-borne infections that may disrupt our immune system and lead to this chronicity. So the listeners are like, hmm, what do I do?
So there are specialty labs that are focused on detecting vector-borne disease. I would say the industry gold standard is IGeneX Laboratories in California. And
Oh,
so
how to spell that?
IGeneX, IGENEX.
Okay.
Okay. So they offer accurate. I believe they're testing if you do, their panel that looks at the immunoblot. And so also it's important to understand like what you're actually looking for. So they have an immunoblot for Lyme disease that I believe looks for 8 species of Borrelia, but that's only 8. So then to get the other balance, you have to order the tick-borne relapsing fever immunoblot. And so if you do the two of those together, that would be the most comprehensive testing that they offer for Borrelia. And so they do offer a PCR, which is a direct test. It's looking for the actual genetic material of the infection. But PCRs are oftentimes negative because Lyme does not like to live in the bloodstream. And basically, a PCR from a blood draw is looking for genetic material in the bloodstream. So I think doing these immunoblots are much more sensitive and you're going to get, a better result without, in my opinion, wasting money on a PCR.
So we've got a lab identified to work with. Likely, my specialist doesn't know about this lab. My primary care person may
Mhm,
not know about this lab. So, again,
mhm.
what do our listeners do?
I mean, so unfortunately, the burden falls on the patients, so the patients have to request that the practitioner use one of these tests through IGeneX. And so they can go to IGeneX's website and they can contact, the lab and they can get that information and give it to their clinician. Recently, IGeneX has actually come out with a much more affordable at-home kit, but it kind of just gives you a yes or no. It doesn't give you or your clinician the ability to actually look at like the level of reaction or know which bands you're testing positive for, which can actually be helpful clinically. But at least it's a starting point. So this is something new by IGeneX where the patient can actually go on, order it themselves. It's a finger stick, so they can actually do it at home and then they can get their result. And just keeping in mind, no test that tests for anything is 100% accurate.
Mhm.
So these tests are up in the high 90s, which is better, than what we're going to get through Quest, for example, because depending on the source, those tests yield false negatives anywhere from 50% to 70% of the time. Another thing that's important to point out is all of these tests that I'm talking about beyond a PCR, and again, I'm focusing just on Lyme for simplicity right now, but they're indirect tests. So, what they're measuring is a person's antibody response or immune response to this organism. And so if you think back and go, okay, well, this is an organism that's able to become chronic because of the way the inflammation breaks the immune system. And now we're relying on the immune system to tell us if it's there or not. Doesn't really seem like a great setup, but unfortunately there's nothing better.
Okay. So I'm trying to help the listeners. I've been sensitized that maybe Lyme or the tick-borne illnesses might be part of my health issues. I
Mm.
could go to IGeneX and I'll get a testing strategy to figure out the Borrelia infections. But you've mentioned several other names: Babesiosis, Bartonella, Ehrlichios, Ehrlichiosis.
Yes.
Those are other organisms that would not be captured by that Borrelia immune blot.
Correct. So you would want to order tests as well. You would have to add all of those other tests on. So we would want to do a separate test looking at Babesia, and we would want to look at IgM and IgG antibody production, as well as ordering what's called a FISH, an FISH test. And then we would want to do Bartonella, we can do an immunoblot. as well as a fish test. And then I'll be honest, Ehrlichia and Anaplasma Quest is pretty good at looking at those. So I don't feel patients should spend extra money out of pocket to look at Ehrlichia or Anaplasma or even Mycoplasma. But there's another one that I haven't mentioned yet called Rickettsia. And so Rickettsia causes Rocky Mountain spotted fever, as well as, there's one or two other species of rickettsia that can cause other things as well. But rickettsia is something that's important to be looked at too. And acute cases of rickettsia can actually be fatal, as can anaplasma. So, it's a complicated topic. And again, there are kind of telltale signs that go back to, especially when someone has an acute or a chronic infection. So, really working with a practitioner, a clinician that not only is Lyme literate, but really is an expert, I would say gives the patient the best bet at, you know, knowing what they should test for and how to test for it accurately. The difference between an acute case and a chronic case, a lot of times I see the scenario where the patient was bit by a tick. They go to their doctor within a couple days. They're tested for Lyme, usually only, and then the test comes back negative. And literally from that point on, it's like, well, you were negative. You were negative. It can't be Lyme. You were negative. And what happens is when those tests through Quest, they're looking at an ELISA. And if you do, typically it's a reflex. So it's what's called a two-tiered test. So if you don't test positive on the first test, they won't even do a Western or immunoblot. So it's important to order both of these tests at the same time, but know that we're still looking for antibodies.
Mhm.
And it takes at least 2 weeks for your bodies to really produce IgM antibodies that would be high enough to earn you a positive on that test. And then IgG antibody production really isn't going to come in and peak until weeks 4 to 6. So if you're testing within the first 3 days or week or 2 weeks, you're likely to get a false positive, even if it is Borrelia burgdorferi, because
You meant to
you're
say false negative.
yes, false
Yeah, okay.
negative. You're
Yes.
likely to get a false negative because your body hasn't had the time to produce adequate antibody response.
Okay, so again, I think for the listeners, they're hearing it's a complicated topic, sorting out all these different potential infectious causes. Hygienics, great lab, to be very helpful. But I think it's probably really very helpful to find a clinician that is aware of of these nuances. So they can do a careful history, a careful exam, order a more comprehensive look at the various organisms that may have been transmitted. So now we get to a complicated question. How can the listeners find someone who's knowledgeable to help them navigate all of this?
So I would say one of my favorite resources, and this is where, besides my personal mentors, this is where I have learned over the past, you know, 15, 17 years, what I know about Lyme disease is at the International Lyme and Associated Diseases Society, or ILADS, ILADS. And so their website is ila.org. And they are a group of medical practitioners, and it's the gamut. So we have MDs and DOs and NDs and APRNs and PAs, and there's a lot of nutritionists and whatnot. So it's a worldwide organization of medical practitioners who basically have dedicated their lives and practices to researching and treating Lyme and vector-borne disease. And now since COVID, they're actually focusing a lot more on chronic inflammatory diseases as a whole. But I would say that is where you're going to find the most cutting edge, up to date information. They have a find a practitioner directory. And then there's other organizations like Project Lyme. There's lymedisease.org. And then actually, I host what's called Lyme Bites. LY. And we just had our annual symposium last weekend. And so we bring in experts in the field of Lyme and vector-borne disease. And we talk about this is more of a functional medicine integrative conference where we're talking way beyond focusing on just killing these infections if you have them. We're really looking at how nutrition, lifestyle, stress, gut health, just overall helping the person to heal their body while eliminating the infections, and kind of like all of the resources that you need to do that. And there's a wealth of information on that site as well, which is limebites.com.
Okay, I've been sort of taking notes here as you go along, and I'm sure our listeners are taking notes. So, finding a medical team to help you na understand your symptoms, your exam, and then getting the appropriate lab testing, helping interpret the results, because in my experience, it's usually not completely straightforward. You have to have some assistance knowing how to interpret all of this, and then making a
Mhm.
decision like, okay, there is a vector-borne illness that is contributing to your current issues, and then we begin navigating a treatment. And can we? I know we could talk for hours about all of that, um,
Yeah.
but I don't want to overwhelm people. Uh,
Yeah.
I'm assuming because you're confident that once we have a diagnosis of what the underlying organisms are, that there is a holistic approach to helping people eradicate or suppress, better manage that organism.
Yes, absolutely. And Terry, I feel the need to just say one thing quickly before I dive into that, if that's okay. So I would say, because you kind of asked earlier about, okay, so I have my MS diagnosis. I know I have MS. Like, why does it matter? Or should I still be looking for if there is a vector borne disease? And I just want to give one tip. I feel like any diagnosis that somebody has been given that has the word atypical along with it, right, is to me a huge red flag. So, there are certain diagnostic criteria, right, to be diagnosed with MS. And I cannot tell you how many people I have come into me with the diagnosis of MS. And it's like, but my doctor says it's atypical. Okay, what does that mean? It means I don't fit the criteria. I'm not having the episodes, the way that I'm supposed to, or I don't have lesions in more than two areas, or I don't, fill in the blank. And so, that to me is a huge red flag. And then another red flag would be okay, let's say you do fit the typical diagnosis, but let's say that you're having all of these other bizarre symptoms that literally have nothing to do with MS. That's when you're like, okay, what could be causing these other symptoms? So just like a simple example would be, to my knowledge, we shouldn't be having chills or, relapsing fevers or, flushing or any of those types of symptoms when somebody just has, typical MS,
Mhm.
correct? So if you're seeing something like that where it's like this doesn't really fit, that's where that red flag or that light bulb should go off that like, maybe something else is what is going on and maybe I need to investigate it because there might be something else like Lyme disease that actually explains all of those symptoms, as well as the demyelinization, which we know can occur from Lyme disease.
Okay, so
Okay. So now I'll
we
answer your question.
yeah, I think we've got a constellation of reasons to think about getting a little further evaluation. It comes back and I have some organism or maybe a couple organisms. What happens then next?
Right. So I like to take at least a six-pronged approach to this. So number one is we have to deal with the inflammation. Because again, the inflammation is what causes the symptoms, and the inflammation is what drives the immune dysfunction or the imbalance in the T helper cells, right? Which can lead to Th17 dominance, autoimmunity, etc. So there are a multitude of anti-inflammatory herbs. Amongst my favorites are Japanese knotweed, Chinese skullcap, cordyceps, Okay, so that's like number one, knowing what inflammatory cytokines are being expressed. And then I love using herbal medicine to help to manage that. Then looking at where is the immune system dominating? Is it in a Th17? Is it Th2? Like what's going on? One of the best herbs to help to rebalance the immune system is ashwagandha. So that's my absolute favorite. Rhodiola can be helpful as well. Then, if we look at what parts of the body does this specific organism like to basically invade and eat for its nutrition and live? Because if we can shut that off, we can help to starve them out. So, without getting too technical, Lyme induces the release of enzymes that break down our collagen and break down our connective tissue. And so this is one of the reasons why Lyme loves to go to the joints, right? Because it has cartilage and ligaments and tendons and all this collagenous tissue in there that it can eat. So it turns out Lyme's nutrient profile that it needs to exist is contained in collagen. And so that's why it loves it so much. Another reason why it loves the joints is because there's not a lot of immune cells there. Like there's not a good blood supply. It's a lot of synovial fluid. Like if you think of the knee or the shoulder, two of the places that Lyme loves to go. So if we use a combination of Japanese knotweed, Chinese skullcap, and ashwagandha, we can actually inhibit the collagenase, the hyaluronidase, and the aggrecanase, which are the three enzymes that Lyme uses to break down the connective tissue and feed itself. So that's number three. Number four is obviously using antimicrobials. So there's a lot of antimicrobial herbs out there that recently, over the past 4 years, have been studied and have actually shown to be as effective as some of the conventionally used antibiotics at killing spirochetes, right, which is the type of bacteria that Borrelia is, the type of Lyme bacteria. And so we can use these antimicrobials and not do such a rough job on our microbiome because as I know you know, our microbiome is critical for our immune system to be able to function properly, as well as manage inflammation, as well as be able to detox. And so that brings me to number six, detoxification. So we have to be detoxing and eliminating all of these endotoxins that these dying organisms are releasing into our body as we kill them. Because if we don't, we will end up experiencing a pretty severe herx. And a herx isn't just like, oh, all of my symptoms temporarily feel worse and I feel crummy and I'm going to lay in bed for a couple of days. When you're herxing, you're actually increasing inflammation. And one of the big inflammatory cytokines that goes up when you herx is interleukin 6. And so interleukin 6 can actually push us back into like a Th17 dominance, right? Which is going to push us down that autoimmunity path again. So, really trying to balance all six of those treatment bases at once, to me, is crucial at getting these infections into remission, which is the ultimate goal. Because I don't think anyone who claims themselves to be Lyme literate actually uses the word cure, right? Because
Mhm.
you have to be able to prove a cure. It's like with cancer, we can't see it, we can't detect it on a test, we don't see it in your body. But most oncologists don't say they're curing cancer. They say we've gotten your cancer into remission. And so that's always my goal, to get these infections to the point where they're no longer causing symptoms, they're no longer replicating. But I would never use the
Would a
word cure.
fair way to think about this is we are using a variety of herbal strategies, and I'm predicting that you're also talking a lot about lifestyle, modifiable lifestyle factors, and eventually we've suppressed and killed off the microbes enough that my immune system is able to properly manage and keep everything at bay. It would that be a fair way to describe what happens with your six-prong approach here?
100%, Terry. Yes. You nailed it.
Yeah. And I'll tell everyone, who's listening, there's more awareness that when we get the various infections that we have, viruses, bacteria, parasites. We never completely get rid of them. They're there all of the time. What we're trying to do is shift the balance such that my immune system can manage them. And it's also why when we get as we get older, and very aware of that now, I'll soon, soon be 69, and my immune system will become less and less effective unless I do a really good job with my modifiable lifestyle factors. Then I keep my immune system healthy and vibrant, and it can protect me from all the mischief makers that I've acquired throughout my vigorous life.
Yes, 100%. And I think, there are people, and I was one of these. I lived with Lyme disease for a long time. I got it somewhere between when I was 8 and 10, but I didn't actually know it and didn't have symptoms of it until I went through an extremely, extremely stressful period in my life and my immune system tanked. And that's when it actually came out because my immune system could no longer control it. So I kind of think about like, chicken pox and shingles, right? So like everyone gets acute chicken pox. And most people, well, years ago, most people didn't end up with shingles. It was a very, very rare thing. But now with immune dysfunction, right, and immune suppression, the virus comes back out, becomes reactivated, and you end up with a shingles infection. So in my mind, I kind of liken the two in that way. I think a lot of us have been exposed to a multitude of bacteria, viruses, etc. And when we keep our bodies healthy, our immune system's able to
Yeah.
keep them in check.
I think most of you who are listening to our interviews go back and think through when you became diagnosed with MS or whatever chronic major health challenges that you have. In every one of my clinical patients where we have this conversation, they can describe to me in the 2 years prior to their diagnosis, there was some major trauma. Either most often it's a severe psychological trauma that happened because of family circumstances or work circumstances that was extraordinarily difficult in that 24-month period prior to their diagnosis. And then it unmasks they become the symptoms are severe enough, they finally go in to see the physician, begin the workup, and get diagnosed. And I think that matches what you're telling me, that there is a severe stress. It might be a physical stress, it might be a psychological stress, and our immune system's no longer able to keep the mischief makers at bay. It turns on the autoimmune process, and then we end up with our diagnosis.
Yes, exactly.
So all of you who are listening, I really want you to take this to heart that we all have to really take care of our immune system. Modifiable lifestyle factors are key. Figuring out, are there these mischief makers, and finding someone through let's see. Now let's make sure we got
Hi,
the
lads.
organizations correct. ilads.org is probably a great place to start. Lyme bites, is that .com or .org?
.com.
.com would be another really wonderful resource. This is, I could talk for another several hours because this is so important. But I know if we go on too long, I'll lose people. But this has just been so wonderful. I wonder if you could tell us how people can find you and your organization.
Sure. Yeah. So I have a website, drhinchey.com. So drhinchey.com. And then my practice, my clinic is Tau Vitality. So TAOVITALITY.com.
So you're still seeing patients.
I am, yes. I,
Excellent.
I have a long wait list. I want to warn everyone because when people call, they get upset. We're doing what we can to try to revamp and get people in sooner, but I just fair warning, I have a pretty long wait list.
Well, again, this has been really a wonderful. I think it's certainly worth considering. Could you have these mischief makers as part of why you developed your Lyme associated diseases? MS certainly is one of them. Your primary care person probably won't know how to do this. Your neurologist certainly may not know how to do this. And so investigating ILADS to find a practitioner in your neighborhood would be helpful. And if you have the time and the resources to go to And what state are you in?
I'm in Connecticut.
In Connecticut, where the hub of where understanding of Lyme disease and tick-borne illness all began.
Mm.
Thank you so much for being with us.
Thank you so much for having me. It's truly been a pleasure and an honor. Thank you.
Thank you for tuning in to Doctor Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Doctor Talks. Real talks from real doctors on the issues that matter to you most.